International AIDS Conference. Now, one of the calls that has come from civil society has been that of greater focus on key populations and vulnerable groups. They account for a third of new infections globally. Now, to speak more on this, I am joined by Alexandra Rodriguez. She comes all the way from Mexico and is a member of the International Reference Group on Transgender Women and HIV. Alexandra, thank you very much for joining us. There was a call yesterday from the chair of the conference, Professor Chris Beira, and he said that we cannot end AIDS without addressing the needs of vulnerable individuals. You agree with his comments?
I definitely agree because the transgender people, transgender communities, transgender populations are being left behind in the AIDS battle. We are not only being invisibilized by being added to the MSM populations, but we're also not getting enough funding, not getting enough attention to the problematic situation that transgender people worldwide, globally, are living on a daily basis. Our populations are still getting infected by HIV. Our populations are still dying from AIDS. So we suffer violence, discrimination. Transphobia is still very, very up to date in our society. So we are definitely one of the populations being left behind.
Now, with the work that you do in Mexico and the US, aside from funding, as you've mentioned, and of course discrimination just on the ground and the community that you assist, what are some of the other challenges? Acceptance, I'm sure, is one of them that you're trying to address on the ground.
The challenges is that transgender people are still lacking access to adequate and dignified health care. We're still not getting access to an education. We still are being limited to being able to get the proper documentation as to how we want to identify as. I'll give you an example. We have one of our members that got hurt while here in this conference a couple of days ago, and she went to the hospital, and the hospital didn't want to give her any services because her papers say one name and one gender, and she represents a different name and gender of what her documentation on her passport says, and she was denied services. That is ridiculous. We're in the 21st century, and one person that for being transgender, being denied adequate and dignified access to health care is a terrible thing, and I don't wish that upon anybody.
Well, with that, I mean, that's identification, and that's the role of governments. And with that, are you concerned, or do you feel that governments of the countries that you are working in are not doing enough?
No, definitely not. Definitely not, because as long as transgender people are still criminalized for being transgender, as long as transgender people are being discriminated against for being transgender, as long as transgender people are still being persecuted for being transgender, the governments are not doing enough. In our society, there's so much stigma and so much discrimination. Transphobia is a big issue in this society that we're living nowadays. And I think it's time now that we bring this to the attention of everybody. The equal rights are equal rights for everyone. It doesn't matter your sexuality, it doesn't matter your gender identity, it doesn't matter who you want to be or what you want to become. You should have equal rights just like everybody else.
Alexandra, you're at this conference to add the voice from the transgender communities, and it's all good and well having conferences like this, but what you'd like to see is the outcomes of these conferences, the commitments being fulfilled. So from what do you want to see coming out of the 21st International AIDS Conference?
Yeah, what I would like to see is no more lip service. I would like to see no more promises. I want to hear actions. I want to see that the AIDS, AIS the international AIDS people are going to be helping the small grassroots community-based organizations that they are going to do what's on their hands to fight, to help transgender people to fight against this epidemic. I want to see that they are going to educate people, that they are going to be funding access to other mediums like yourself,
yes,
the media, and I don't know, education to be able to fight against this epidemic.
Alexandra, thank you very much for your time. Alexandra Rodriguez, she's come all the way from Mexico to add their voice, representing the transgender community. And they're calling for greater focus on high-risk populations. More coming from the conference. We've certainly got a lot more people to speak to. And we're going to explore this topic and speak to more of vulnerable communities, sex workers, people who are taking drugs. There's many more people that we are hoping to speak to unpack this topic and the issues that they face. But for now, it's back to studio.